4, we learned about overcoming barriers to accessing professional mental health care. It is not always easy to get the mental health care that you need. There are a lot of hurdles, and those hurdles seem to be increasing these days. Are you unsure about who to reach out to? You can start with your family doctor or your rheumatologist if you have one. They can help you to identify professionals in the area that may be particularly experienced working with people with arthritis, and they'll get you to those trusted sources of mental health care. But you can also look for them directly yourself. Every state or province has a licensing board for mental health professionals, and they maintain lists of qualified professionals along with their area of expertise. So you can go online and you can look through these lists and you can see someone who might be an especially good fit for you. There are counseling services that are available through many employee assistance programs, or for students, there's the university health services that may be available. Also, universities that offer training programs for mental health professionals will offer services and clinics with their trainees at a reduced rate. Community mental health clinics may also be available in your area and offer the services at low fees or even no fees. What has really changed in the last few years is the availability of brief online self-help programs. These are often available at very low cost or even no cost. And while these won't work for everyone, particularly if the symptoms are more severe, for many people, this option can be very, very effective. Another major barrier for many people has been the fact that it takes time to see a mental health provider. There's the time of getting to the office and parking, all that entails. This is where virtual care is really making a difference. Virtual care is very common. I would say about 50% of providers now offer virtual care, and some only offer virtual care. You meet with a professional online using a secure connection. Virtual care has now been shown in a number of studies to be every bit as effective as in-person care. So you're gaining a lot of convenience and perhaps even a lower cost in exchange for the virtual care. For people with arthritis who live in remote regions, or for those with mobility challenges, virtual care has made a real difference. And also, don't forget that there are many community and faith-based resources that may be available to you, as well as family and friends. Gaining support from a number of different resources, particularly community resources, family, friends, even peer groups, are all good ways to help improve and sustain mental well-being.